When exercising at a maximal aerobic ability, so as hard as you can, whether it's getting on a treadmill, going as fast as you can, or like a hard aerobic endurance-based exercise performance, like a race or something like that, there are going to be a lot of things that are not going to function as well at altitude as what they would have at sea level. So let's talk about some of those things as it relates to the cardiorespiratory system. We're going to separate this for the first 6 to 10 days on this slide, and then on the next slide we'll talk about what happens after 6 to 10 days when some acclimation has occurred. All right, so before any acclimation has occurred, so you first get to altitude, you're going to have a decrease in your cardiac output at maximal exercise intensities. Again, the key here is with maximal exercise, you cannot compensate. So things are at their ceiling, and the ceiling is going to be lower. So you're going to have less cardiac output at maximal exercise. This is going to be driven both by a decrease in maximum stroke volume and a decrease in maximum heart rates. The stroke volume is going to be decreased at maximal exercise because we have less plasma volume, so we can get less blood in and out of your heart per beat. And the heart rate at maximal exercise is going to be a little bit suppressed because the heart becomes less responsive to sympathetic activity. When you go up to altitude, sympathetic activity goes up and your heart starts to desensitize to that pretty quickly. And so once you get to maximal exercise intensity where sympathetic activity is really pushing hard and driving hard, and normally your heart rate would go very high, it's just going to be a little less responsive to that because it's been experiencing that all day long for however many days you've been at altitude. So lower cardiac responsiveness to that sympathetic drive, lowering that heart rate, lower stroke volume, lower heart rate means lower cardiac output at maximal exercise. Let's look at what's down here now. So your VO2 max, which is the amount of oxygen you can consume, which is essentially your aerobic fitness or aerobic ability, is going to be dramatically decreased at altitude. This is going to be because we have less AVO2 difference, so arterial venous oxygen difference, so less oxygen extraction, dramatically less so, and decreased cardiac output max. The AVO2 difference is going to be decreased because we have a lower partial pressure of oxygen gradients between the blood and the air within the lungs. Right, so the air that comes into your lungs is going to be less dense, so you get less partial pressure of oxygen pushing that oxygen into the bloodstream, and so you're going to get less oxygen floating around your blood, which means you can extract less oxygen from that blood once it gets to the muscle. The cardiac output is going to be lower for all the reasons we mentioned up here, so we've already covered that. After the first 6 to 10 days, when some acclimation has occurred, the effects on your VO2 max is going to be a little less so. It's still going to be a negative effect. You're still going to be having a harder time with exercise and having lower exercise performance. And the primary driver is going to be that decreased AVO2 difference max, or that decreased oxygen extraction from the lower partial pressure of oxygen driving the oxygen into the blood and getting out to the muscle. Also still going to have some effect of the cardiac output. This is, though, going to be a little bit different depending on how high the altitude is. So at sort of lower to moderately high altitudes, the primary factor is going to be that lower amount of oxygen on the hemoglobin, leading to that less AVO2 difference, the lower AVO2 difference. Cardiac output is going to be suppressed, but not nearly as impactful as the AVO2 difference. Once you start going above 4,000 meters into some really high altitude environments, think very high mountains like Mount Everest, now you're going to have all those effects of your hemoglobin having less oxygen attached to it, leading to lower AVO2 difference, and it is going to get worse as the altitude goes up. It's going to continue getting worse, but the effects on cardiac output start to be more and more noticeable. So you're going to get greater decrements in cardiac output, more so than what you had before 4,000 meters. We're really focused here on exercise performance at altitude, but if you're at a high enough level of altitude, you can also start getting some negative effects at rest, and also some pretty serious side effects that can be deadly. We're going to be talking about that in another video where we talk about altitude or mountain sickness.